Hi, it's David, and today we're diving into 3 key topics that hold surprising secrets about your lung health. It's mucus, phlegm, and sputum. Oh joy. You're going to learn what are they, how they're different, and why you should care about this. So let's dive in. First of all, what is mucus? Mucus is a slippery, gel-like substance that's produced by mucous membranes throughout your body. It includes the respiratory, the digestive, and the urogenital tracts. And its primary functions are to trap irritants and pathogens. It helps keeping your tissues moist and reduces inflammation risks, but it also supports the immune system with antibodies and enzymes. Now, what is phlegm? Phlegm is a specific type of mucus that's produced in the lower respiratory tract, which is your lungs, your bronchi, and the trachea. And the role in the body for that is to be a protective barrier, and it traps harmful particles and pathogens, like let's say like an air filter in your furnace. Now, another thing is the immune function. It neutralizes infection with antibodies, and that's important to keep your immune system boosted. Another one is that it helps with the clearing mechanism because it works with cilia. And cilia is just little hair fibers. Think of a conveyor belt. So you have phlegm in there and it starts to move, and those little hair fibers move and get the phlegm out. And it really helps clear the irritants out of your lungs from, as we call it, mucociliary escalator. Fancy word for just getting the phlegm out. Another one is moisture regulation. By having the phlegm in there, it keeps the airways always hydrated, and that reduces irritation. So the third one is, what is sputum? Sputum is a combination of phlegm and saliva that's expelled during coughing. And the difference between phlegm and sputum is that phlegm refers to mucus in the lower airways, and sputum includes the phlegm plus saliva and debris and bacteria and other expelled materials. So why should you monitor this? It's really important because changes in characteristics can signal infections, chronic conditions, or even certain environmental exposures to things that you're breathing in. So here's the 4 factors of phlegm and sputum that I want you to be aware of. And it's color, odor, texture, and amount. So we're going to start with color first. So normal phlegm is usually clear, and that's exactly what we want. Now, again, if you have any concerns about this, if there's any changes in any of these things, these are when I want you to call your doctor. If there's a change in the color, the odor, the texture, and the amount. Now, yellow phlegm, some of the indications of the yellow phlegm are that it can reflect an active immune response. And now, not all yellow phlegm is an infection, because sometimes you have some white blood cells like neutrophils, and they accumulate in the mucus and they have a little bit of a yellow tinge to it. And that typically appears in inflammation, which, like I said, could be allergies, or it could be an infection. One of the things you want to find out is, do you have a fever? That's a really big flag. And that's, again, information you want to pass on to your healthcare team, because viral infections that don't require antibiotics could have some yellow phlegm. And also allergies can cause persistent inflammation, giving you some yellow phlegm. Sometimes environmental irritants like smoke or pollution can also give you some yellow phlegm. So that's one of the things I want you to think about. Now, yellow phlegm doesn't always, like I said, have to be an infection. So if you have any questions, talk to your doctor about it, because whether or not you have a fever will help give them some key critical information. Now, green phlegm is commonly associated with infections because a lot of times it often signals a more advanced immune response, and you get a little bit of myeloperoxidase, which is an enzyme from neutrophils. It's just a fancy word that kind of describes that, and that gives it a green tint. Now, it's not always an infection because chronic conditions like sinusitis or bronchitis, and even after you're recovering from a viral illness, you could get some green phlegm. So I want you to just think about that. Again, you're always going to talk to your doctor. It's not always definitive proof of a bacterial infection because other symptoms have to be considered. Going on the color spectrum now, you talk about brown or black. A lot of times that indicates exposure to smoke, pollutants, or old blood, and sometimes even food like coffee or chocolate can give it a brown or black tinge. So again, Talking to your doctor can help differentiate that. Also red and pink, and sometimes blood tinged, because sometimes people, especially with a pulmonary condition, can have some blood tinged sputum and phlegm. So that could signal serious issues like tuberculosis or cancer or pulmonary embolism. If you have that, don't panic, talk to your doctor, because ironically, it could also be from food or drinks like red wine or coffee or tea or eating beets and berries and chocolate. Those can all temporarily change the color. So don't panic, talk to your doctor about it, talk about your symptoms. A lot of times, if it's just the food related, those changes are harmless and it resolves naturally, so you don't have to worry about it. So we talked about color. Now we're going to talk about odor. Now, normal phlegm doesn't have any smell. It's odorless. Foul smelling phlegm, if it really doesn't smell like there's something right, that may indicate some sort of an anaerobic bacterial infection, some sort of a lung condition. It could be a lung infection, it could be pneumonia, it could be bronchitis. Any of those things can give you some foul smelling phlegm and sputum. Now, texture. That's the consistency of it. Normal phlegm should be a little bit thick, a little bit sticky. That's normal. But if it's really overly thick, overly sticky, that's common from dehydration or maybe infections, or even a lot of chronic pulmonary conditions have a lot of thick and sticky fume. Now, it could also be foamy or frothy. And now that could be linked to pulmonary edema if there's a lot of foam, a lot of froth and everything that's coming out. And that also could be, if it's pulmonary edema, you could have some of that pink in there as well. Then there's watery phlegm, and that's usually associated with allergies or early viral infections. When like your eyes are watery and your nose is watery, that's also going on in your lungs. Another fun fact is that the effect of dairy and ice cream, because a lot of people will say, oh my gosh, every time I have that, it makes me cough. What happens is dairy products like milk and ice cream can make the mucus feel thicker and stickier, although they don't really increase mucus production at all. The last one is amount. So we went color, odor, texture, and now we're on amount. So you want a normal production. Small amounts are absolutely normal because that's your way of your lungs to clear themselves. So we want that. Excessive amounts, that can suggest that something's going on. It could be a pulmonary condition like bronchitis or COPD, or even an infection. The good news is you get all that information, you share this with your doctor, and they might do some tests. Because if they're going to evaluate it, they're going to take your sputum, you'll spit it into a little cup, and then they're going to look for any pathogens like bacteria or virus or any fungal infections, anything like that. And they're also going to assess the cells that are in there, whether they're inflammatory or any cancerous cells or anything like that. So they're going to look at that. They're also going to monitor your chronic conditions like COPD or bronchiectasis or even cystic fibrosis. They're going to use all that together to set a really good treatment plan. So they may either do a sputum culture, which is really simply they'll give you a little cup and you'll spit into it and they're going to analyze it. And then they can also, like I said, they can do some cytology where they'll look at it a little closer and they'll look for abnormal or cancerous cells. So right now you're probably saying, okay, you have all this information you've given me, you scared the heck out of me with some of it. When do I call my doctor? So a couple of things that I want you to think of. First of all, if you have any concerns, always call your doctor. But some of the ones that I really want you to think about, because if you do call them, it will be helpful if you can, like I said, discuss the color, the odor, the texture, amount. And if anything like that changes, that's when you want to call them. Another one is if you have blood in your phlegm or sputum, because that's something that they would want to know about. Or if it continues and it's persistent or it worsens, that's something that's going to let them know that something is going on. Other symptoms could include fever or chest pain or difficulty breathing or wheezing, or if you're noticing that your pulse ox is really starting to drop below 92 is, we don't want that. We want always 92 or higher. But if it's consistently dropping, then you want to talk to them. And if your symptoms are lasting longer than 7 to 10 days without any improvement, you're definitely going to want to tell them that too. And a lot of people wait too long, so we don't want that. Let's talk about the tips for managing phlegm and sputum. The first one is really important, hydration. I want you to drink plenty of water as long as you're allowed. Some people are on water restrictions, so just check with your doctor, make sure that that's not the case. But if you can, drink plenty of water because you want to hydrate from the inside out, because that helps to thin the mucus to really help it come out easier. Another one is some warm fluids like some herbal teas and some broths. Those can be particularly effective to help the phlegm. Another one is humidifiers and saline sprays. Humidifiers are really, really good, especially here. I'm in Connecticut, in New England. It's wintertime, it's cold. The heat is on, it's dry. I have a couple of humidifiers running throughout the day because I really want to keep the humidity level a little higher than normal, because that really helps. Saline sprays are also really good because they help loosen the mucus. That way it can come out a lot easier. There's also dietary considerations I want you to think about. You want to limit your dairy and sugary foods because those can increase mucus thickness. You want to consume some anti-inflammatory foods. Now remember, I'm not a registered dietitian, so you want to talk to them. But normally, anti-inflammatory foods like fruits, vegetables, and your omega-3s, they can really support your respiratory health and boost your immune system. Another way to effectively get the mucus out, if you haven't seen our video, How to Cough Effectively, I teach you in there how to huff cough. And that's really important. It gets all the air down underneath the mucus and gets it out. So if you haven't watched it, I highly recommend that. I'll try to leave the link in the description box below, and also the incentive spirometer video that I did. That's really important. The right way to use your incentive spirometer, we'll put that link in the description box below, because that helps get the air in and expand your lungs. Another one that people will say to me is, David, after I use my nebulizer or my rescue inhaler, I end up coughing. Why is that? And that's because a lot of times the phlegm is already there. That didn't produce the phlegm, but it's like a cork trapped in a bottle. The airways are tight, the phlegm is down here, and what ends up happening is you take those medications, your airways open, and now the phlegm can come out. Another one is some over-the-counter meds, like an expectorant. So you could take like guaifenesin, and that helps thin the mucus for easier airway clearance. Or decongestants like pseudoephedrine or phenylephrine. They reduce nasal sinus congestion because they shrink all the blood vessels. Now, decongestants can dry out the mucus, potentially making the phlegm a lot harder to get out. So you want to make sure that if you are taking that, you're going to increase your water intake. And don't take any over-the-counter meds without talking to your doctor, because they can all interact with each other. Another over-the-counter med is an antihistamine, and that's used for allergies. But excessive use of antihistamines can also dry out the mucus, and it makes it harder to clear, so we don't want that. Another one is sometimes your doctor will put you on an antibiotic, and that will help clear up if it's caused by an infection. So no matter what it is, you always want to talk to your doctor to make sure that the medications are going to be proper for you, and you want to make sure that there's not going to be any interactions with anything. Some lifestyle adjustments you're going to want to make: avoid smoking and exposure to allergens or pollutants. And you really want to practice good hygiene in terms of bringing up the mucus, but also taking in a lot of water to keep it thin. Keeping the mucus out really helps. Also, posture and breathing have a big impact on this. Maintaining good posture improves your lung expansion, and it really helps get rid of the mucus. And breathing techniques like our flow-controlled breathing or diaphragmatic breathing, they can really enhance your lung efficiency and help get the phlegm out a lot easier. And like I mentioned earlier, watching our huff coughing video is good. Using our incentive spirometer video is good. Those are all things that will really help. Now, I know that there's probably some emotional and psychological issues with this because we have to consider that, because chronic mucus or sputum issues can cause some anxiety, some embarrassment, and even some frustration. You don't want to be out in public, especially nowadays with everybody's hyper aware of post-COVID. You cough out in public and it could just mean that, you have a little bit of congestion. Doesn't mean you're sick. Everyone's going to get nervous, and that could, like I said, lead to you being some anxiousness and some embarrassment, frustration. So we don't want that. So if there's any way that you need to discuss that, talk to other people that have pulmonary issues. There's a lot of support groups. You could talk to your doctor, and it's really good. There's strength in numbers. So one of the things I want to do is, let's recap. Color, odor, texture, and amount. If any of those change, that's when I want you to call your doctor, give them the specifics of what changed, how it happened, when it happened. That's all really important. And having that open line of communication is the best thing that you can do to stay healthy. I hope this helped you. I know it's a lot of information. Thank you for taking the time to watch this. I really appreciate it. And I hope you found this helpful. And if you did, please share this video with anybody that you think that can benefit from this, because really we're all in here to help each other, and we're all in this together. I'll see you in the next video.